Hello everyone, welcome to the Cardiac Wire show at AHA Scientific Sessions 2024, and we're going to have a conversation with the leaders from AccurKardia today. We have Juan Jimenez and Moin Hussaini from AccurKardia. And first of all, to get us started, maybe you can give us an introduction to yourselves and AccurKardia, and then we'll go from there.
Thank you, Jake, for having me. Juan Jimenez, co-founder and CEO of AccurKardia. In AccurKardia, we are building ECG technology to make it a broader biomarker and improve the diagnostic capability of that signal. We have our flagship product, AccurECG, is an FDA-cleared Class 2 software as a medical device for automated analysis of Holter, extended Holter, and mobile cardiac telemetry data.
Hello everyone, my name is Moin Hussaini. I'm Chief Product Officer for AccurKardia. I'm primarily focused on developing the novel use cases for AccurKardia, like our aortic stenosis detection model, cardiac amyloidosis detection model, and hyperkalemia, to name a few. And really excited here to share a little bit more about those efforts here with Jake.
Yeah, so actually I remember hearing some buzz about your aortic stenosis detection model at TCT a couple weeks ago. Maybe you can share a little bit about what you talked about and the recent study that you presented there.
Absolutely. So I had the great opportunity to present the results from one of our studies at TCT, showing the capability of our model to not only detect with ECG through ECG aortic stenosis, but also predict future onset for aortic stenosis. And so I had the opportunity to present those results at TCT as part of the innovation program.
Right. I mean, I hear so much in the presentations here about the clinical value of early detection. So something like that has just so much potential.
So, absolutely. So the big news out of TCT this year was the early TAVR results.
Right.
And what they found was that treating asymptomatic patients earlier had significant benefits. And so if earlier treatment is better for patients, then earlier diagnosis is key. And what we're proposing to do is help identify patients earlier by screening them through their ECGs that are sitting in hospital system electronic health records to catch the disease earlier in its progression and treat them earlier and find those asymptomatic patients.
I'd like to add, Jake, that we less than a month ago received FDA breakthrough device designation for our aortic stenosis model. Mm-hmm. And we're excited to continue the validation of this model, and we are hopefully going to soon launch a pilot project with an academic medical center so we can prove our capability with prospective data as well. So we're very excited and looking forward to share the news with you first.
Right, that's really ambitious. There's still very few AI products or detection products that have used prospective data like that. So that's really neat. When you look at your results from your previous studies, what are some of the things that you've learned that maybe that you would be looking for in that prospective trial?
I think, as I mentioned, one is the ability to prove our capability to detect years before onset of the disease. I think that will be key to help manage the disease as it progresses. Mm-hmm. And I think I'd like to show scientific value of our capabilities in the prospective study that we will conduct soon. And also I'd like to add something with a story you published several months ago about the cardiology deserts. Yeah. And I believe technology is the one we are building, empowering the ECGs obtaining primary care to use it for more capabilities than they're currently used for, is going to be add more capabilities and better management disease in areas where there is a lack of cardiology practices.
Right. That's really interesting. So maybe while we're talking about detection of more diseases, maybe you share a little bit about what else you might be able to use ECG as a biomarker to detect.
Absolutely. So structural heart conditions, so aortic stenosis is one of them, but there's other structural heart conditions like tricuspid regurgitation and mitral regurgitation, heart failure, HFrEF, HFpEF, cardiomyopathies, and then hyperkalemia is another condition. So there's quite a few that ECG can be used for. Anything where the condition has a physiological effect on the ECG, where there's a known effect, we can train models to identify that effect and correlate it to the condition.
Got it. And all those conditions are pretty much conditions that are better off detected and treated as early as possible.
Absolutely, absolutely. In some cases, the application we're developing is not so much a screening tool. So take the hyperkalemia use case. What we're proposing to do is monitor end-stage renal disease patients that are on dialysis who are at risk for hyperkalemia,
Right.
and then monitor them at home when they're outside of the clinical setting through their wearable device, like a smartwatch. And then because the symptoms of hyperkalemia are very non-specific, or they may not have symptoms, even though they might have severe disease, that makes the patient more vulnerable to sudden cardiac arrest. And what we're hoping to do is alarm when the patient's hyperkalemia may be worsening and notifying them that they need to seek medical attention before they have a severe exacerbation of the disease that leads to emergency hospitalization or sudden cardiac arrest. So that's another example there where we're using AI to identify a condition through ECG, but it's not necessarily a screening or diagnostic tool. It's more of something like continuous glucose monitoring, where you're monitoring the status of the patient and letting them know when they need to seek, manage their condition or seek medical attention.
Right. It's amazing to think of how much more can be based on everybody's perception of what can be achieved and how ECG can be used, and how much more is
I call the all ubiquitous ECG something that is more than 100 years old. It's used in clinical setting all the time, and it can be used for more than it's currently used for. And that's what we are building for, to make an impact in patient outcomes, saving lives with information already available in the system. We are not envisioning to get new devices, buy new equipment. I think doing more with the information we already have.
I love it. Well, thank you so much.
Thank you, Jake.
Congratulations on all you've achieved so far. I can't wait to see the next steps.
Awesome. Thank you.